this year's program, we got all the topics which are interesting for our clinical work. We got vascular work, aortic, arterial, a lot of venous. We got neuro, non-vascular, oncologic, embolizations. So our participants, they are gonna have the possibility to see the educational value of our work, the clinical value, the research value, the scientific value, the implications with the other clinical subjects, and we'll have opportunity to get real hands-on on our material and methods and techniques, discuss everything with the top experts of the whole world.
Today we will talk about the non-traumatic bleeding patient. We will have lectures on pathways, how to manage these patients, how to improve our CT protocols, clinical management of the patient, and obviously follow-up and patient assessment after the procedure. The 3 points I want to have you to take home is that you assess a patient clinically and that you do it properly and spend a lot of time on it, that you have a good imaging, and if you have a mismatch between imaging and clinical presentation, rely on your gut feeling, follow the clinical presentation.
This morning we have a very interesting session on crossing complex arterial occlusions. There's a segment on wires and wire technology. We're going to have a segment on crossing catheters, also on re-entry devices and how to use them with the best way and the evolution of them. And I'm going to focus on the retrograde access and the situation where you have to deal with complex cases where we have to use a different access than the conventional one.
So in today's session, we're going to talk about percutaneous pediatric intervention. All 4 speakers are going to talk about various aspects of percutaneous intervention in children, from how to child size the technique to more specific part biopsying tumors, hepatobiliary intervention, urinary tract intervention, and gastrointestinal intervention. You might think that as an adult IR, you're not going to touch children at all. Well, that's not true. They come in emergencies, and you really need to think about if you see the patient, how you're going to child size the technique, and how you're going to adjust the dose, and how to help the patient.
We've got the most hands-on sessions ever at CIRSE, and it's a real opportunity, particularly for young IRs or IRs who want to increase their skills and expertise to learn and develop the techniques and the skills that they need to use the latest devices in treating a variety of pathologies. Now, the biggest change is we've got the GI lab, and it's designed to train the young IRs in these important skills. Learning about the needles, the wires, the drains, the stents, which are significantly different from other areas of interventional practice.
In today's session on portal hypertension, which is focusing on TIPS placement and is drafted by EASL and CIRSE, we will covering first the indications for TIPS, second, typical scenarios to place a TIPS, and third, the consequences of encephalopathy, which will be discussed also at the end.
So pancreatic cancer is one of the most dreaded diagnoses for patients with not many treatment options. And up till about maybe a decade ago, interventional radiologists were only involved in maybe the diagnosis, pain management, or relieving biliary obstruction. And that has changed over the last decade when we've used ablation techniques, especially image-guided ablation techniques, to treat pancreatic cancer and play a role in the multidisciplinary team and be actively involved in the management. So it's exciting to share that experience with the audience at CIRSE.
I hope that everybody who will visit this Congress will have something to remember for the rest of their lives.